Hi, I'm Dr. Sherilyn Walker, and I'm a licensed professional counselor in the Austin area. I've been a therapist about 14 years, and I wanted to make a series of videos called Getting the Most of Your Therapy. I've worked with lots of different clients in my career and wanted to give you some tips to avoid missteps and self-sabotage when you're seeking therapy. Number one is about the intake process. Now, you've obviously done some research and you've probably spent a fair amount of time checking the credentials and whatever information you can find online about the therapist that you've scheduled an appointment with. And when you go and see that therapist, make sure that you ask them questions. If you have any concerns right off the bat, if you want to know more about their background, feel free to ask, and we would be more than happy to answer, because we want to be a good fit for you just as much as you want to be a good fit with us. And something I notice is that sometimes people will go in for one session and then they have a concern that they don't address, or they have a question that they don't address, and then they don't go back. So that leads me to number two, which is give the therapist a chance. Therapists are human, and sometimes we might be having a bad day, we might be tired, we might be off our game a little bit. And, of course, that doesn't mean that you should tolerate a therapist who is rude to you or doesn't listen or is fundamentally unethical or unqualified to treat your issue. It just means realize that you might need to commit to 2 or 3 or even 4 sessions to get an idea of the potential relationship that you'll have with that therapist. If something makes you mad or upset in therapy, talk about it. Sometimes it's not the therapist who really triggered the upset feelings or made you mad. It might be part of what your underlying issue is. So when you bring that up and you address it in therapy, that's where the growth comes. And it actually helps you to solidify your relationship with that therapist. So number 3 is faith and religion. So just because your therapist is religious or of a different faith than you, don't let that dissuade you from having a relationship with that therapist and seeking treatment from them. Therapists are trained to work with all types of people and to keep our personal beliefs from overly impacting the services that we deliver. Now, there are Christian therapists and religious-based therapists, and if you go to a therapist seeking that, then that will be more prominent during the session. However, if you find that your therapist, maybe displays a religious article in their office and it gives you pause, ask about it and let them know your concern, and we're more than happy to address it. Therapists care about people and we want to help. We certainly don't want to have you feel uncomfortable. And again, addressing those concerns is part of the relationship. Thank you so much for watching. Stay tuned for part 2, and if you're interested in more videos, please subscribe. I'm Dr. Sherilyn Walker.